welcome once again to yet another press briefing at the NACOVERC's headquarters here in Kinton. Today we have Mr. Kone, the psychosocial pillar liaison. We also have Major Dr. Gevao here with us, and the official spokesperson, Solomon Jamiru Esquire. And we have members of the press, including our sign language interpreter here with us today. We will go straight to the status update, and I would ask the official spokesperson to give us the official figures for today.
Thank you, Harold. I join you in apologizing to our people and especially to our friends in the Fourth Estate. Status update for 6th July 2020. Cumulative confirmed positive cases, 1,547. Total number of deaths, 62. Active new cases, 5. Active cases at isolation centers, 399. Cumulative recoveries, 1,086. Number currently in quarantine, 1,376. Number discharged from quarantine, 7,900.
Thank you very much, spokesperson. At this stage, I would ask Major Dr. Gevao to give us the status update in terms of the cases by district.
Thank you very much, Mr. Harold. So, in 24 hours, the total samples that were analyzed, though we collected more samples, but the ones that have been analyzed so far is 121. Of the 121 samples that have been analyzed, we have 5 positive results and 116 negatives. As of today, we have analyzed a cumulative total of 13,107 samples. Distribution of these 5 positive cases by district. Western area rural, 3 cases. Western area urban, 1 case. And Tonkolili district, 1 case. Making a cumulative total positive cases for today of 5. Thank you very much.
Thank you very much, Doctor. We would ask the psychosocial liaison officer to give us an update with regards to psychosocial activities.
Well, let me take this opportunity to thank our partners, including UNICEF, Plan International, Defense for Children International, PIH, for supporting a nationwide training of trainers program, which targeted 320 trainers, social workers and mental health workers to go out into the communities to train other people in delivering psychological first aid. Thank you.
Thank you very much for that status update for COVID-19 for the 6th of July 2020. From where Corona starts, 31st of March 2020 to now, we don't get 1,547 people that were positive for Corona. The one that we don't die as a result of Corona, we get 62. And the new case that we test positive today, now 5. And the one that we in a treatment center for COVID-19, now 399. The one that we done well, now 1,086. And the one that we did in a quarantine, we at the Toxo now 1,376. And the one that we don't come out quarantine so far, now 7,900. Thank you very much. Good afternoon, everybody. Welcome back to today's press briefing here at the EOC's premises at Kobi. Today we have members of the press here, and we also have our official spokesperson, Solomon Jamiu Esquire. We have the sign language interpreter here, and we are expecting Dr. Givau to join us very shortly, another subject matter expert. Today, I would ask the official spokesperson to give us the status update for today, the 7th of July. Over to you, sir.
Thank you, Harold. Good afternoon, everybody. As we continue to have in our hearts, in our prayers, our thoughts and best wishes, families of those who have succumbed to the disease, our friends, our loved ones in treatment centers, in community care homes, in quarantine homes. May I proceed with the updates for 7th July 2020. Cumulative confirmed positive cases, 1,572. Total number of deaths, 63. The last being a 64-year-old from 34 hospital. Active new cases, 25. Active cases at isolation centers, 421. Cumulative recoveries, 1,088. Number currently in quarantine, 1,390. Number discharged from quarantine, 7,925. I just wish to add, and I think this is material information to pass on, with a view to expanding the scope of treatment centers, we have seen 6 additional treatment centers set up in
Yes, yes.
6 additional CTCs, treatment centers, set up in Western area, Falaba district, Koinadugu district, Bo district, Tonkolili district. Precisely, and I crave your indulgence to just pass this on. Precisely, Adra
That is Waterloo.
at Waterloo, Masanga, Bo Government Hospital, Bo Children's Hospital, one in Koinadugu district and one in Falaba district. So this should take us about 17 treatment centers in about 13 districts. For the treatment centers, our bed capacity is at 702. And for the CCCs, our bed capacity is about 445, giving us total bed capacity of 1,147. So now we have treatment centers in about, I think, 14 districts right now. Over to you, Harold.
Okay, thank you very much. May I ask everybody in the room to put on your mask properly? We don't want to put anybody at risk here. Cover your mouth and your nose, please. Okay, can you just give the disaggregation in terms of districts for the positives?
So 25 positive cases based on 254 samples analyzed. 25 positive cases, Western area rural 1, Pujaun District 6, Tonkolili District 1, Putloko District 16, Kenima District 1, Western Rural 1, Pujaun 6, Tonkolili 1, Putloko 16, Kenima 1, giving us a total of 25 positive cases based on 254 samples analyzed.
Thank you very much. Good afternoon, everybody. Welcome to today's press briefing for the 8th of July 2020. We have journalists here in the room from different media houses, and also the psychosocial liaison officer, Mr. Kane. We also have a sign language interpreter here with us, and Major Dr. Leone NACOVERC, a subject matter expert, and we have with us Solomon Jamiu Esquire, who is the official spokesperson. My name is Harold Thomas, Risk Communication Lead. Today we will start the press briefing by asking the official spokesperson to give the status update for today, 8th of July 2020. Over to you, sir.
Thank you, Harold, and good afternoon, everybody. Our hearts go out to families of those bereaved families, and we continue to say, may the souls of those who have succumbed to this disease rest in perfect peace. We continue to pray for our brothers, our sisters, our fathers, our mothers, our loved ones in treatment centers, in community care centers, in quarantine homes. And we continue to say thank you to all those who contribute to the fight against coronavirus. Status update for 8th July. Cumulative confirmed positive cases, 1,584. Total number of deaths, 63. Active new cases, 12. Active cases at isolation centers, 399. Cumulative recoveries, 1,122. Number currently in quarantine, 1,361. Number discharged from quarantine, 7,977.
Thank you very much. At this stage, I will call on Major Dr. P.P. Gevau to give us the status update with regards to the cases by district. Over to you, sir.
Thank you very much, Mr. Howard. So in 24 hours, we analyzed a total of 267 samples. For the 267 samples that you analyzed, we have 12 positive, 255 negatives. As of today, we have analyzed a cumulative total of 13,628 samples. Distribution of today's positive cases by district. Bombali District, 1 case. Koinado District, 1 case. Karine District, 3 cases. Putloko District, 2 cases. And Western Area Urban, 5 cases, making a total of 12 positive cases for today. Thank you very much.
Thank you very much. And this is the 15th week of the COVID outbreak in Sierra Leone. And for week 14 last week, there is an increase by 15% of cases compared to the previous week. The number of COVID tests conducted last week increased by 30% over week 14 compared to week 13. And the positivity rates of samples reduced from 8% in week 13 to 7% in week 14. So, and the western area, rural, there is an increase in the proportion of cases reported in the western area rural. As you all know, of the 25 cases reported yesterday, 16 out of these new cases reported were from Potloko district. So that's the situation if we just look back and compare trends within the week. At this stage, I would ask Mr. Kone, who is the psychosocial pillar liaison, to just give us a brief update on psychosocial with regards to the response.
Well, currently we are grappling with some child protection concerns. Remember, some examination children have started going to school, and some have started experiencing stigmatization from their friends. We even have a classic case wherein a child has attended school from a quarantine center. That is very, very concerning. So we are currently working with other pillars to ensure that we speed up swab taking of some of those locations, to ascertain the results of the children that are going to school. Because if a child is positive, for instance, there is a high risk that they may pose risk to other children in the school, and that could also enhance community infection. So we are currently working on that to ensure that the children are safe and their colleagues are also safe in school.
Okay, thank you very much. A very good afternoon to you all, and welcome to today's press briefing for the 9th of July 2020. We have, as usual, Mr. Kone, who is the liaison officer for psychosocial pillar. We have a sign language interpreter here. We also have Major Dr. P.P. Guevara here, and our able spokesperson, Solomon Jamiru Esquire. And we also have members of the press here, including our public health relations officer for the Ministry of Health, and also Emmanuel Ogundi, who is also a technical support officer. My name is Harold Thomas, and once again, welcome to today's press briefing. We will start today's press briefing by giving the status update, and that will be done by the official spokesperson. Over to you, sir.
Thank you, Harold. Good afternoon, everybody. We continue to remember those who have succumbed to this terrible enemy. We continue to have in our prayers loved ones in quarantine homes, in treatment centers, in community care homes. Status update for 9th July 2020. Cumulative confirmed positive cases, 1,598. Total number of deaths, 63. Active new cases, 14. Active cases at isolation centers, 412. Cumulative recoveries, 1,123. Number currently in quarantine, 1,301. Number discharged from quarantine, 8,092. Carol.
Thank you very much, spokesperson. At this stage, I would ask Major Dr. Guevara to give us a status update in terms of disaggregation of cases by district.
Thank you very much, Mr. Harrod. So in 24 hours, we analyzed a total of 133 samples. The 133 samples that we analyzed, we had 14 positive cases. 119 negative cases. As of today, we have analyzed a cumulative total of 13,761 samples. Distribution of today's positive cases by district. Western area urban, 3 cases, and Western area rural, 11 cases, making a total of 14 cases for today. Thank you very much, and over to Mr. Howard.
Thank you, and we would now have updates from the psychosocial pillar.
Well, the psychosocial pillar continues to play a very significant role in the active storage operation. We recently, yesterday, targeted various speech bars and other centers at Aberdeen and Lumley to pacify people to participate in the storage operation. And tomorrow also in the Western area, we're starting to monitor compliance of COVID-19 regulations, for school children that are attending schools. So that will start tomorrow to ensure that they're safe.
Thank you. On that line also, the spokesperson would want to add on the surge updates.
Yes,
So
it's a good thing that our colleague from Psychosocial has mentioned the community engagement. And we know that the people of Sierra Leone, they are very keen in getting the data for the active case search. And we had made that commitment, and our experts continue to look at the figures. But what is important is that we are looking forward to increasing. We had made a commitment to see how we could expand the scope from 180 average to about 400 or even more. And for us to achieve that, we have to intensify community engagement. As our colleague from Psychosocial has said, the public would recall that when we had the 3-day stay at home, we actually did a pilot community engagement on testing because we know our priority is to test those who need to be tested, focus on our primary contacts based on their exposure to previous cases, and test them at mid for the 14 days or at the expiration of the incubation period. We also test those who present different symptoms at our isolation facilities. But it's important, with evidence of community transmission, we have to start going into communities to see how we could do some tests. So at this particular time, we are focused on, one of the things we are focused on doing is to really intensify this community engagement that has been spoken of. So we are expecting that perhaps by the weekend or early next week, we should be able to expand on the current scope of tests. It may appear that based on the indicative commitments that we had made from 180 to 400, it would appear, and this is indeed, it is true, the public would have expected that with the enhanced case surge, that we should see some mind-blowing figures. Well, that is not the case at this point, but the encouraging sign, the encouraging thing is we have started. Week 1 of the surge, I'm sure when we reported on day 1, we are talking about 380 tests and 173 analyzed, which we reported on day 1, apart from the routine 124 tests. We attempted to also report on day 2, but then we advised ourselves that because this will be too much work for people in labs, people in surveillance, and they would need time to clean up the data and give us accurate figures, we decided to place a moratorium on the daily reporting on the active case search. And we made a commitment to see how we could come back to the people and do weekly reporting. We're still sticking to that commitment. We ask the public to please bear with us. This is a very crucial phase of the response. Expanding the scope means perhaps additional manpower. It means that additional financial and logistical considerations. So all of that would have to have their toll on the operations. Please bear with us. Let's see if by this weekend or early next week we should start providing some active case search specific data for you. Our guys are actively at work on this one. But the important thing is we cannot achieve all of these if we have not engaged the community actively. So the community engagement is going on, social mobilization, psychosocial, risk communication. We have gotten into this very crucial phase of the operation so that the communities are also at par with what we do. And once we start doing the community testing, what we don't want is to start experiencing those levels of resistance and see how we can diffuse the misconceptions as well. So we have made the commitment to you, people of Sierra Leone, and we will not waver on that commitment, and we will endeavor to bring you the active case search specific data. Harold.
Thank you very much. And yesterday, being the 15th week of the COVID-19 outbreak in Sierra Leone, was the 100th day of the COVID-19 outbreak in Sierra Leone. And so far, the highest number of cases were reported over week 8. And the COVID-19 cases reported over week 14 increased by 15% compared to week 13. And the number of COVID tests conducted increased by 30% over week 14 compared to week 13. And the positivity rate of samples reduced from 8% in week 13 to 7% in week 14. So this is the trend in the last 7 days.